So our association has directly benefited from the GOLD project. We enriched our professional portfolio as a training organization. Association Generations works for people aged 50 plus, building social bridges by implementing intergenerational practices, developing and realizing soft skills trainings like diversity management, for example, variety of topics related to the aging population and the aging workforce in particular. Thanks to the GOLD project, we gained experience and new methods of social inclusion, health maintenance, engagement in society, in the digital world, and more. The best practices gathered within the GOLD project gave us the opportunity as a training provider to offer innovative tools, approaches, soft skills, transversal training methods, which are already applied, which have been tested and verified within the partners organizations we are working with this project for the elderly. It will benefit the target group we are working with, other training providers like we are, social workers, psychologists, nurses, educators, and other relevant professionals, and the elderly people themselves. Some of the GOLD practices from our French and Greek colleagues we have already implemented. We had groups of elderly who undertook walk tours with some cleaning actions, like for example, cleaning the cemeteries in the small towns they are living in, gardening in their living environment, and more. We are working in frame of European projects at the moment on creative interaction, and we are going to exploit the GOLD project results in the next 2 years, while the European projects will be running, and to share and apply internationally our GOLD knowledge gathered with our European practice partners. They are game designers in some of the projects, game developers, artists, to interact professionals, third-age people, psychologists, caregivers, students, and volunteers. And the goal is to create innovative games that enhance the skills of third-age people in order to create an intergenerational environment and social impact.